And as the coronavirus spikes, the Shelby County Health Department is still without a permanent leader. Last week, a Shelby County Commission committee voted to recommend the full commission approve Dr. Michelle Taylor as the next director of the county health department.
However, since that decision, a personnel memo has surfaced that reveals an interview panel did not recommend Dr. Taylor for the job. The full commission is expected to vote today, and ahead of that, we're live with Commissioners Mark Billingsley, Amber Mills, and Van Turner to get their perspectives. Mark, let's start with you because you've expressed some concern about the mayor's statement to you that Dr. Taylor was in fact recommended. Is that your biggest concern with this memo, or in general, are there other things that concern you more?
My concern is that the mayor put together an interview panel. They made a decision, and when I asked Mayor Harris what their decision was, he misled the commission. My specific concerns are not about Dr. Taylor, but they're honestly just about the honesty and the transparency of the mayor when county commissioners, which is the board, and as you know, the Shelby County is really run by a very strong board. Myself and other commissioners expect honesty from the mayor, and this is not politics. This is not racial issues. This is specifically asking the mayor a simple question and not getting an honest answer. And as you reported just a minute ago, we're still in the middle of the pandemic. It's upticking, and again, as a commissioner, you have to ask the hard questions and you expect hard answers back. I didn't get an answer that was accurate.
All right, right now I want to bring in Commissioner Van Turner. Commissioner Turner, you've been very outspoken since this memo was leaked. Is this politics? Is this racial? How do you view it?
Well, you know, I think that in a city like Memphis and dealing with a board that's elected, there will always be issues of politics and race, whether that's an overt situation or whether it's something that's not readily seen. So, you know, I think that's something that we can handle at a different time. But today we need to appoint Dr. Michelle Taylor. As we all know, the Delta variant is upon us. We need a permanent director. Dr. Taylor comes to us with 5 degrees. One degree is from Harvard. The other degree is from Johns Hopkins. She's a licensed physician. She's from Memphis. And so I think that we would be doing this community a disservice not to go ahead with the appointment of Dr. Taylor. If there are issues with how the mayor rolled this out or presented the issue, that has nothing to do with the Delta variant. It has nothing to do with Dr. Michelle Taylor taking over. And it definitely has nothing to do with us trying to save lives in this community.
Amber, your thoughts?
The fact that the mayor lied in an open meeting to commissioners is very troublesome for me. I voted for Dr. Taylor in committee. I have appointed and voted in favor of every nominee he's brought before us that he has had to appoint. But to be lied to and then just told, you do as you're told, step in line, we need somebody as qualified as she is and all of her credentials and her phenomenal resume, I, for one, cannot get past that the mayor lied about the panel view. And that is very disturbing to me in all of this. And it's such a shame that this happened to Dr. Taylor. She pretty much had the rug pulled out from under her. This should not be a discussion. It should be the accolades of Dr. Taylor. And unfortunately, because the mayor decided not to be truthful about the panel recommendation, now we're discussing this.
And Commissioner Billingsley, I want to bring you back in also. You know, you'll have some people who will argue that maybe this is about the way the mayor handled or maybe mishandled the situation, but others are also saying for you, this is also because you are considering a run for Shelby County mayor. Clear that up for us or set the record straight.
Well, I appreciate everyone thinking about me and my future, but I have not announced that. I have not formed an advisory group for myself. I believe if you want to be considered for other leadership roles, you do a good job at what you're currently doing. The mayor's race is a long ways down the road. Mayor Harris has not even announced if he's running for re-election. I am sort of known for doing my work, my hard work. One of the questions I would have asked Mayor Harris, if he would have given an honest response is because Dr. Taylor is so well educated, she's from Memphis, she understands Memphis. Would she have? My question would have been, could we try to secure Dr. Taylor as our chief medical officer? She would be an unbelievable chief medical officer. I mean, having a physician in that role, but we weren't able to even discuss that because, and that apparently was a suggestion from the interview panel, is that we should really consider Dr. Taylor for chief medical officer, which we desperately need in the health department. The other role as director is a little bit of a bureaucrat. You're dealing with a $102 million budget. You're dealing with 700 staff. You almost need a Dr. Fauci level at the health department. I believe Dr. Taylor would have been an amazing chief medical officer, and I would even support increasing the salary for that position for Dr. Taylor. I also believe, because of the makeup of our community, we need an African American in that role to deal with the underserved children and the sick of Shelby County.
But some people, Mark, there are some people who also will say that they don't like the way you worded some of the comments about Dr. Taylor, just saying that she's, quote, articulate, and they read more into it the way that was phrased.
Let me answer that. That is absolutely misinformation, and that I didn't write the memo. That the memo that everyone continues to reference was written by Dr. Lasagna Hall, the acting director of the health department, who is also an African American. So again, you just quoted that I made those comments. I have never, ever made those comments. And if you read the memo, it didn't come from Mark Billingsley. It came from our chief over that area, who just literally encapsulated what the interview panel said. So again, this morning, I'm being tagged with a memo that I never wrote. I had nothing to do with the memo. And the author is on the memo. And then the mayor's office actually sent that memo out to members of the committee. So again, if you read the memo, it says it's from Dr. Lasagna Hall. It's not from Mark Billingsley. We didn't even know the search was.
I'm sorry to jump in, Mark. We're out of time. To bring it back, though, to the health situation, is it possible, or would it delay it too much, for the commissioners to interview all the members of the interview panel and say, why did you not recommend her, to get some specifics health-wise? Van, would you, and then Amber?
No, I don't think so. 85% of the comments you heard this morning have dealt with the mayor and what the mayor said or didn't say. None of the comments are dealing with the Delta variant. None of the comments are saying to this community that we need a health director in place right now. I would vote for Dr. Michelle Taylor because I believe that as an African-American woman who's gone off and done great things, she deserves this opportunity to render this type of service back to the community from which she is from. And I think that's how we all should feel, and that's how we all should vote. If we have a beef with the mayor, that's something totally separate.
Amber,
we should not interview other panel members. I was on the panel member, and I can tell you that she was the best candidate for this position. And you will see that I think she will do well, and I plan on voting to support Dr. Taylor this afternoon.
what about public trust, though? Amber, last word is yours.
All of this could have been avoided if Commissioner Turner had spoken up when Mayor Harris said that she was the recommended candidate on the panel. This all could have been avoided. And that's the sad part of this. This should not be the discussion. If we had had honesty on Wednesday, this would be Dr. Taylor's day, that we would be moving Shelby County forward. Instead, we're dealing with who told the truth, who didn't tell the truth. And it's a sad day for Shelby County.
All right, commissioners, unfortunately we're out of time, but thank you very much for your time and being on Live at 9 to give your perspective about this ongoing debate.
Definitely a
We do
big
appreciate
issue.
it.
Thank you for your service as well.
Right.